Inguinal canal is a musculoaponeurotic canal measuring about 4 centimeters in length, extends from the deep inguinal ring to the superficial inguinal ring. Inguinal canal will have an outlet. The outlet is formed by a triangular slit-like opening which is called as the superficial inguinal ring. The superficial inguinal ring is present at about 4 centimeters above and lateral to the pubic tubercle. The superficial inguinal ring is a defect formed in the external oblique aponeurosis. So this is the outlet. What about the inlet? Can you see this? This opening is what we refer to as the deep inguinal ring. The deep inguinal ring is an opening in the fascia transversalis. This forms the inlet. What about anterior wall? If we close the external oblique aponeurosis, the anterior wall is entirely formed by the aponeurosis of external oblique covered by the skin and superficial fascia. In the lateral one-third, the internal oblique also accounts for the formation of lateral wall. What about the posterior wall? Now, if we retract the spermatic cord, the posterior wall is formed by the fascia transversalis. In the medial half, it is strengthened by conjoint tendon formed by the union of internal oblique and transversus abdominis muscle. What about the roof? Can you see this? The roof is formed by the arched fibers of internal oblique. So, internal oblique muscle presents a triple relation to the inguinal canal. It forms the roof, it forms part of the anterior wall, it also forms part of the posterior wall by forming the conjoint tendon. What about the floor? Can you see here? The floor is formed by the thickening of the lower margin of external oblique aponeurosis, which we refer to as the inguinal ligament. So that is the inguinal ligament. In case of males, the contents of the inguinal canal include the spermatic cord and the ilioinguinal nerve. Can we see this? This is the spermatic cord along with the testis, right? In case of females, the most important content is the round ligament of uterus. The spermatic cord in turn contains number of structures which we have learned in the specimen of the testis, right? Apart from this, one important content of the inguinal canal is the ilioinguinal nerve. When we group the contents of the inguinal canal, the spermatic cord is referred to as the complete content and the ilioinguinal nerve is called as the incomplete content, because spermatic cord enters through the deep inguinal ring, exits through the superficial inguinal ring, whereas the ilioinguinal nerve enters the canal by passing through the posterior wall of the inguinal canal, then traverses through the rest of the inguinal canal before it exits through the superficial inguinal ring.